Welcome back to Balanced Health. We're talking today about chronic fatigue syndrome. It's a debilitating and complex illness that can be challenging to diagnose and to treat. And here, of course, with us to answer some of the questions that you sent in about it is Dr. Karen Burgner from the Dwyer Medical Clinic. Thank you for staying with us and coming back to be with us on this segment. As we said earlier in the show, it's very widespread, and we actually have some very good questions. Joe, did you want to say anything before we get to these questions about it?
No, let's.
Okay, let's go for it. This lady called and she said that her sister had polio in 1953, of course, the big polio outbreak. And she said she was actually not diagnosed with polio. I think she ran a fever and had a stiff neck at the time. And now she said for the past 5 years she has developed severe fatigue. And do you think that is a link to her polio exposure?
So in a patient like that, the key concern would be something called post-polio syndrome, which can occur anywhere from 10 to even 30, 40, 50 years later. And the post-polio syndrome is actually different from chronic fatigue syndrome in that if you actually do nerve or muscle biopsies, you'll see degeneration at the motor neuron unit, which leads to progressive muscle weakness, including the respiratory muscles and occasionally the bulbar muscles, which control swallowing and breathing.
Wow, so she would have to have different kinds of treatment.
Exactly.
Yeah,
so this in the post-polio scenario, you would need to evaluate to make sure that it's not actually post-polio syndrome, because that has fairly different treatment ramifications and diagnostic tests that would need to be pursued.
Okay.
Doctor, how about our kids out there, our teenagers who where mono is so prevalent? Yeah. Mono is tied to a specific virus, like a herpes type virus, right?
Yeah, mono is caused by the Epstein-Barr virus.
Oh, Epstein-Barr virus, okay. Which is a herpes?
It is.
Okay.
HHV2.
Now, when somebody has mono, this fatigue is all part of the deal. Can chronic fatigue syndrome, are they kind of the same thing at that point? Can somebody transcend from one scenario to the other? Usually
not. There is some thought with chronic fatigue syndrome that there's an inciting event, i.e. a viral illness, severe life stress or whatever, that kicks off the disease. However, mononeucleosis or acute Epstein-Barr viral infection is a separate entity. Unfortunately, Epstein-Barr viral infection, when it's acute, often has fatigue associated with it for up to 3 to 6 months. It's just the normal course of the illness. So,
what would be some of the delineating factors that you would use to say, no, it's not CFS, or you don't have CFS now on top of mono because you don't have what? I don't see what?
Well, usually a patient who comes in with acute mono has severe sore throat. They have very swollen glands, very enlarged tonsils, usually severe upper respiratory symptoms along with it, a lot of purulent sputum from the nose, low-grade to even high-grade fevers, as well as the severe fatigue and classically splenomegaly. Additionally, on laboratory studies, they'll have very high levels of the immunoglobulins that are the acute phase reactants to a new infection. In a patient with new mono, who I was following over time, I'd expect them to resolve after about 3 to 6 months with the fatigue. In a patient who comes in who'd had mono remotely in the past, I wouldn't associate the current illness necessarily with the prior EBV infection.
I see. How about the whole yuppie syndrome? They used to call it the yuppie virus. It was kind
mono?
of... Yeah, no.
CFS?
CFS. It was tied to people at a high... I mean, that's what they classified me as. And do you see any socioeconomic parallels to CFS patients?
And unfortunately, I would disagree with that moniker. CFS really does strike across all socioeconomic boundaries. It can strike from the very poorest to the very wealthiest amongst us. And unfortunately, it does not have a class predilection.
Gosh darn, it made me feel successful for at least a while. I was really tired and stuff, but I was successfully tired.
Call yourself a yuppie, be happy, okay. Well, you know,
I want to be a yuppie.
We touched on this a little while ago, early in the show, but it's the whole tie to, to the depression. And this caller is saying, if I can find the question here, she said it sounds so much like anxiety, depression. You know, how do you know? And I think we actually kind of maybe exhausted that a while ago, but you want to help this caller in some way.
Absolutely. Depression is classically characterized by at least 2 weeks of feeling sad, of hopelessness, despair, feelings of worthlessness, feelings of guilt. In addition, there are certain physiologic symptoms that come along with it. Oftentimes they have increased pain, sleep disturbances, either sleeping too much or not being able to sleep at all, changes in their appetite, either with complete loss of appetite or, especially in women with atypical depressions, they'll just start binge eating.
Wow, okay.
And there's a few other symptoms that are classic for depression. In contrast, chronic fatigue syndrome, they'll have severe fatigue, but they also will classically have the sore throat, the low-grade fevers, enlarged lymph nodes, as well as muscle tenderness, muscle pain, joint pain, without any physical exam findings to explain the joint and the muscle symptoms that they're having.
Well, we have about a minute here. We were going to touch on the treatment and what kind of treatments are anything new and exciting in the CFS world. What are you doing?
At this stage, really the keys to treatment are, number one, developing a good relationship with your provider and developing a long-term relationship, because it is a long-term disease and you need to have that physician-patient interaction. Additionally, cognitive behavior therapy is really the mainstay of treatment, working with a therapist one-on-one. Additionally, the graded exercise, like we talked about, often with a physical therapist, somebody who is expert in dealing with chronic fatigue syndrome, so that you can slowly increase a person's stamina so that they can get stronger.
Well, and I think probably too, good diet, good nutrition has, which was in your case part of it. Well, if you have any health questions, email them to us at balancedhealth@tln.com, and for more information, visit www.tln.com and click on shows and then Balanced Health. And also remember to call 888-242-9393 if you'd like a copy of today's show. And we'll be right back with your healthy habit of the day, so don't go away.